Today, we're happy to welcome from Henry Ford Thoracic Surgery of Jackson and Hillsdale, nurse practitioner Rhonda Albrecht and thoracic surgeon Dr. Mohan Kulkarni. Welcome to the show.
Thank you.
It's only our second Wellness Wednesday. Great to have you here. You know, thoracic surgery, I know we've talked about this before, Dr. Kulkarni. Let's talk about what it is before we get into some of the issues in your practice. Who wants to take that one?
I can take that one. I usually tell people to think about the fly. You know, it's got three parts: the head, the thorax, and the abdomen. So I'm basically in the thorax, which is the part between the neck and the belly. I do everything but heart. A heart surgeon would be someone that specializes in heart and big vessels. And then I do everything else in the chest, like lungs, esophagus, diaphragm, chest wall, trauma, that kind of stuff.
So those of us who remember maybe biology in school, if we dissected grasshoppers and ants, the thorax, that's it.
That's it. That's me.
Awesome.
Yeah.
And Rhonda, you're new with the practice.
Correct.
Tell-
Recently joined. Peripherally had worked with Dr. Kulkarni for many years prior to joining the practice as a staff nurse, and worked with him parallel as a nurse practitioner with the pulmonary group prior to joining him.
Awesome. And you've got quite a background both in nursing and as a nurse practitioner.
Mm-hmm.
You went to school first for nursing,
Correct.
was a nurse for a while,
Correct.
and then you decided to go back.
Correct. For approximately 17 years, I was a staff nurse and continued my education while working as a staff nurse. I obtained my master's degree, continued to work, achieved my nurse practitioner board certification, and then went back for my doctorate degree in nursing and graduated just recently in 22 with my doctorate. So I've been a registered nurse for 17 years and then a nurse practitioner for 17 years total.
Wow,
As
awesome. Well, congratulations on your latest accomplishment. And while we're talking about accomplishments, coming up for Dr. Kulkarni, his 30th year in Jackson, Henry Ford. That's amazing.
30 and going.
And going, yes. And we're talking about, I think there might be something special at 30. So it might be a watch.
Rolex.
We'll just put that hint in. The disease of, that we've talked about before with you several times, lung cancer. Obviously that is one of the areas that you work with, but you've got some other things like GERD.
Correct.
Am I saying it right?
Mm-hmm.
Yeah.
GERD. What is GERD?
So GERD is gastroesophageal reflux disease. Most people know it as heartburn, and everybody gets a little bit of heartburn. You know, you eat late or your mother-in-law is visiting, and that can cause some heartburn. But it becomes a disease sometimes when it's uncontrolled. You have it several times a day. It wakes you up at night with acid or food in your mouth. Then it becomes dangerous, and that needs to be fixed.
Is it life-threatening?
It can be. Sometimes the stomach kind of goes above the diaphragm. That's called a hiatal hernia, and that can cause GERD or reflux. And then the stomach can sometimes twist up there and create an emergency. So it can be life-threatening.
I think a lot of people will treat that with things like Rolaids. Is that the recommended solution for you?
Well, commonly, you know, if you get heartburn occasionally, if you cheated and ate late or went to a party, then you can just pop a Rolaids once in a while. But if it becomes like a pattern and ongoing several days a week or wakes you up at night, then you might want to get on some medications, see your doctor about getting on things like Prilosec. I wouldn't take them too long because they have some potential side effects like bone loss or brain dysfunction. These are not like hard evidence, but there is some soft evidence that it may not be good for you if you take it for a long time.
Are there some things that you can do that aren't Prilosec or Rolaids?
So one of the things we do, half my practice is lung cancer, and the other half is workup for GERD or reflux. So we can scope you and make sure your esophagus is okay, your swallowing tube. We check the lining because sometimes the lining can change to a pre-cancer, and then you got to have a scope done every 2 or 3 years, just like a mammogram, to make sure it doesn't progress to becoming cancer. And then we can do stuff to prevent that too, like a hiatal hernia repair, which is we do it robotically with minimally invasive small holes, and we fix the anatomy so that you don't get reflux.
And some people have the upper GI looked at when they get a colonoscopy.
Yes.
Two for the price of one.
Yes.
Well,
And
not really.
they're separate scopes. People always ask, you know. We use a separate scope for the esophagus and one for the colon. And it's a good idea if you're having chronic reflux to make sure things are okay in there. Make sure there's no precancer or infection in the stomach. So it's a good idea.
Rhonda, how does someone know if they have GERD?
By the symptoms, as Dr. Kulkarni alluded to, nighttime awakenings, hoarse voice, feeling like you have hot breath, heartburn typically is the main complaint. Any chest discomfort that wakes them up in the night sometimes can be the GERD symptom.
Can people eat too fast and simulate the symptoms of GERD and not have GERD?
Sometimes, and a common complaint is the food gets stuck. The food gets stuck in my chest. I can't swallow. So those are other symptoms to have the patients come in and see us, and a scope would be indicated in those circumstances.
Well, we all love to eat, so it must be really frustrating for a patient that, just by eating, it's a discomfort.
And sometimes when people stop going to restaurants because they experience the food getting stuck. And it can also be like an emergency where a piece of meat or thick bread can get stuck, and then they try to drink water to let it pass, but then the water just builds up and then you throw it up or it goes down the wrong pipe. So it can be devastating, yeah.
And it's just people don't want to risk that discomfort or making a scene.
Yes.
Correct.
So lung cancer, as we mentioned, that's another area. Used to be you got a diagnosis of lung cancer that was not good. We've made progress.
We have, it's still a big challenge because lung cancer, I feel like it doesn't get enough press. It kills more Americans than breast and colon combined. And also, non-smokers get lung cancer. So a lot of the time the feeling is, well, they did it to themselves, they smoked their lives. But now 20% of lung cancer occurs in non-smokers. So I think we need to be a little more sympathetic towards them and treat them kindly.
Yeah, there's that attitude. And people, oh, well, you did it to yourself. You should have quit smoking.
Yeah.
We've got things like wildfire smoke that's going to have an effect on our lung health too.
Mm-hmm. Correct.
You don't have to be a smoker to be affected by smoke.
Yes.
You are in a new location. You've
Correct.
moved. Where were you before?
We were on the same floor, except we were in suite 201,
Okay.
and now we've moved to suite 211. You just have
down the
to
hall.
turn left instead of right out of the elevator.
And there you are. That's in the professional building right next to the main hospital.
Yes.
Nice. Do you need a referral to come see you?
It would be helpful if you have some lung issues to get a referral, and we encourage people to get lung cancer screening done now. If you've, Rhonda can tell us the criteria that if you meet those criteria, then you should get a screening.
What are they?
So if you're age 50 to 80 years old and you were a smoker, anything over 20 pack year history. And when we talk about a pack year history, sometimes that's complicated math. However, it's very simple. You take your average amount of cigarettes that you smoked per day times the number of years you smoked. So if you're 50 to 80 years old and you have a greater than 20 pack year history, we encourage the primary doctors or any provider to order a lung screening on the patients. If you're a continued smoker or have stopped smoking over 15 years, it's still meeting criteria for lung screening.
So if you stop smoking, is there like a number of years that's the magic that your lungs are returned to normal?
That's a hard question to
Yeah.
answer. That's a hard question to answer, but of course we have encouraged everyone to get the screening. The insurances have authorized the screening to be covered in most circumstances, so we encourage the providers to get that ordered for the
Great.
patients.
And you can see it a lot better, with the technologies that you have now. You've got a
Correct.
new fancy machine.
We have a CAT scan, and it's a low dose CAT scan, so you don't get the radiation like a regular CT. The sooner you find a lung cancer, the better chances you have of surviving it. And the smaller ones that haven't had a chance to spread, we can take them out robotically, and it's not as injurious to the chest wall. We can make little holes and put cameras in and then use robotics to remove that. So the sooner you find it, the better off you are.
Early detection is
Yes.
always the key.
Yes.
Mhm.
Great to have you both with us today. Good to see you.
Always nice to be here.
It's Wellness Wednesday, presented by Henry Ford Health. Thanks to thoracic surgeon Dr. Mohan Kulkarni and nurse practitioner Rhonda Albrecht. Stay tuned. We've got a few things